Welcome back to Community Conversations. I'm Steve Mantis and my guest Jules Tupker with the Thunder Bay Health Coalition. So Jules, we've covered a little bit of the issues in our healthcare system, lack of funding, how that has actually played out in terms of service delivery. The other side of the equation, in terms of our government finances, is the revenue coming in. So we're talking about they're squeezed in terms of how much they can spend on our healthcare. What about the revenue coming in? What do we know about that?
Well, we know that the government makes revenue, makes money to provide these services through taxes, and there's all kinds of information out there that has told us that the government has reduced the taxes to a number of people, especially corporations. There's been huge cuts to corporate taxes, and they've done that with good intentions to try and to induce the economy, to speed up the economy. But we found, and there's all kinds of studies again, that have found that corporations are using those tax savings to basically pay for, to give better dividends to their shareholders. And we found that a number of corporations are just sitting on that cash. So they're not putting that money that they've saved through tax dollars into the economy. So the government is basically a double loser. They're losing income from tax dollars, and the tax dollars aren't being used to stimulate the economy, so it's a double loss. So when there's no money coming in, there's less money to go out. So the money that the government is not bringing in, they're not able to pass on to the provinces to provide health care.
So the big tax cuts, I hear you saying, have really been for the corporations, that corporate taxes. So that now corporate taxes are payable, as far as I understand, on the profits that a corporation makes.
Exactly.
So if a corporation doesn't make any profit, they pay no taxes.
Right.
But if they do make a profit, then their tax rate now is what, a 15%?
Right now, the corporate tax rates are averaging around 15% in Canada, which is well below the average around the world, in the industrialized world. We are very low.
So where do some of the other major countries, like the European countries, where do they stand in terms of corporate taxes?
They're in the 25 to 30 to 35% bracket. So you can tell that we are way down as far as that goes.
So we could be charging our corporations only half of what corporations pay in many of the European countries.
Exactly. Yeah.
And what does that look like? What kind of dollar amount are we talking about here?
Well, we're talking billions. We're talking absolutely billions of dollars that the government is losing. The Canadian Centre for Policy Alternatives, they estimate that there's probably about $15 billion a year lost, at least $15 billion a year lost in corporate taxes that could be going to the federal government, the provincial government, to pay for things, including healthcare, obviously.
So we're losing $15 billion just in the reduction that we've given to corporations for taxes, with the hope that they're going to promote the economy, get us all jobs.
Get us all jobs so that we can all start pay more of our own income taxes. So there's more people making more money, and then they would recoup that through income taxes, and more businesses starting up, and then of course they would pay corporate taxes, they would pay business taxes, and it's so that's how the cycle works. But it's just not happened.
So what we've seen, and we were talking earlier, I think, is that the cash that's available to the corporations in Canada that is actually rising. They're starting to accumulate lots of billions and billions.
Right, and again, they're not spending it. The research has shown that they're either sitting on it and they're putting it in offshore accounts, apparently. And I'm not an expert on that, but that's what we've heard. Or they're increasing their dividends to their shareholders, which does nothing for the economy.
Okay, so we have to. So sure, we're all in favor of a balanced budget. But we have to look at both the revenue coming in and the expenses going out. Most of the discussion is really about how do we divide up the pot we have, rather than really looking at what goes into that pot that then allows us to provide the public services that we all hope to have when we need it.
Exactly. Yeah.
So what are your recommendations from the Health Coalition around the taxes?
Well, obviously, we feel that if the government should try and increase the taxes. If their tax cuts haven't stimulated the economy, and the results are poor income and poor health care that's being provided. And of course, we're always interested in the health care. Then there's only one way around that, is to improve the money that's coming in by increasing the taxes. And we feel that they should be able to increase it, even a portion of that difference between what we're paying and what the other industrialized countries are paying.
So you're not advocating immediately doubling the amount of taxes
Oh,
for
absolutely not.
just a slow increase
Exactly.
to try to balance off the needs of our citizens with the abilities of the corporations to contribute to that.
Exactly. Let's turn this thing around. Let's try and get some more money into the coffers, into the pockets of the federal government and the private or the provincial government, and then they in turn would pass that on to the provinces, to the citizens, to help the citizens get the services that they require.
So you were saying earlier too that there is a health accord between the federal government, Canada, and the provinces.
Yep.
What's happening there?
Well, that is renewed every 10 years, and it was the last one was renewed in March 31st of 2004, and the next one has to be renewed on March 31st, 2014. And the federal government is not doing that. They are not negotiating with the provinces to renew that accord or to improve that accord or do anything with that accord. It's basically sitting there doing nothing. And that's a real concern. And of course, the federal government has announced that they're going to cut the funding to the provinces by $36 billion over the next 10 years. And they should be sitting down with the provinces and having some discussions about that, because clearly the provinces, and including Ontario, which is going to get the major portion of that because of the population of Ontario, are going to be suffering because of that problem.
Well, I'm no expert in this, but this sure makes me concerned. Our healthcare system is a national program, national standards set by our federal government, and they are not moving forward to actually have an agreement with the provinces that actually are the ones that deliver the frontline healthcare services. What's going to happen here?
We don't know.
Oh my gosh.
We have no idea what's going to happen. We can just surmise that it's going to get worse. It's certainly not going to get any better from what we can see.
So what is the Health Coalition doing around this issue, and how can our viewers participate in this?
Well, we're trying to rally the people. We're basically saying when as the Health Coalition, when we go and talk to our MPPs or the Health Ministry or the MPs, we say we represent a whole bunch of people, but again, at the end of the day, they can look at us and say, well, there's 4 or 5 of you here, and we know you're concerned, but you don't really represent we don't know that you represent as many people as you say you represent. So basically, we need the people to rally. We need the people to come to us, to contact us through our website. They can call me on my phone. They can send me an email on my email address, and let us know that they're concerned. We also need stories. We need people to tell us what their stories are. If there's a problem in healthcare, let us know what's going on. If they're stuck in a hospital and there's been some problems in the care at the hospital, they should let us know, because that's what the powers listen to. They want the hard facts, and if we can give them the hard facts of people that have struggled because of the problems in healthcare, then they start to listen.
Jules, we're running out of time. Thank you so much for joining today. We're going to have you back to explore this further, because healthcare is something that we're all interested in, and we all want to make sure we have it when we need it. You'll have information about how you can get a hold of Jules if you want to get involved in this. We want to encourage you to provide feedback to our show. You can contact me through my email address. Upcoming shows, we're going to focus our next show on the changes that are happening in workers' compensation. And following that, we'll have another show on some environmental concerns with a guest from the Citizens United for a Sustainable Planet. Thank you very much for watching, and we sure would appreciate your feedback. Have a good day.
Let us care for each other. That's what we all gotta say.